Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today we are talking about atomoxetine, also known by the brand name Strattera. Before we get started, remember that this education is for learning purposes only. It does not replace medical advice, diagnosis, or treatment from your healthcare provider. Please do not start, stop, or change any medication without speaking with your prescriber. Alright, let's talk about atomoxetine. And don't worry, we are going to keep this simple. We are not here to wrestle with an ADHD textbook, a norepinephrine lecture, and a liver enzyme chart all at once. We are here to understand the medication in a way that patients, families, students, and providers can actually use. No unnecessary big words, no confusing medication gymnastics, just clear education with a little fun. What is atomoxetine? Atomoxetine is a non-stimulant medication used to treat ADHD. It is also known by the brand name Strattera. In simple terms, atomoxetine helps improve attention, focus, impulse control, and emotional regulation by increasing norepinephrine activity in the brain. Atomoxetine is not a stimulant. It is not amphetamine. It is not methylphenidate. It is not a controlled substance. It is not a medication that usually works in 30 minutes. Atomoxetine is more like a slow-building focus coach. It does not run into the brain with a whistle and clipboard saying, "Everybody focus right now." It works gradually over time. What is atomoxetine used for? Atomoxetine is used for attention deficit/hyperactivity disorder, also called ADHD. It may help with inattention, poor focus, distractibility, impulsivity, hyperactivity, emotional reactivity, difficulty completing tasks, difficulty organizing work, trouble following through. Atomoxetine may be considered when a patient does not tolerate stimulants, there is concern about stimulant misuse, or the patient has anxiety with ADHD symptoms, the patient needs all-day symptom coverage, or the family prefers a non-stimulant option. Stimulants are not appropriate due to medical or clinical concerns. A simple teaching line is, atomoxetine is a non-stimulant ADHD medication that works gradually and needs to be taken consistently every day. Mechanism of action: how atomoxetine works in the brain. Your brain uses chemical messengers called neurotransmitters. One important messenger for attention and focus is norepinephrine. Norepinephrine helps with alertness, focus, attention, task completion, and impulse control. Atomoxetine blocks the norepinephrine transporter. That means norepinephrine is not taken back up as quickly. More norepinephrine stays available, especially areas involved in attention and executive function. In simple terms, atomoxetine helps the brain keep focus-related messages available longer. Think of the ADHD brain like a busy office. The phone is ringing, the printer is jammed. 3 people are asking questions. Someone opened 47 browser tabs, and nobody knows where the appointment note went. Atomoxetine does not magically clean the whole office in one day. It helps the office manager slowly organize the system so the brain can focus better. Atomoxetine is not a light switch. It is more like installing better office management software. Please remember, it takes time. Atomoxetine is not a rescue medication. It is not taken only on school days, work days, or bad focus days. For most patients, it works best when taken consistently every day. A patient may say, "I took it this morning and I still got distracted." That does not mean it failed. At one dose, atomoxetine has barely found the conference room. It usually takes several weeks to see clear improvement. Week 1 to 2, the body adjusts and side effects may appear. Week 2 to 4, early focus or impulse control improvement may begin. Week 4 to 8, clearer ADHD improvement may be noticed. Beyond 8 weeks, dose adjustments may still be needed. So teach this clearly. Atomoxetine is a daily non-stimulant. It builds gradually. Starting dose, titration, and maximum daily dose. Atomoxetine dosing is often weight-based, especially in children and adolescents. For children up to 70 kilograms, a common starting dose is 0.5 milligrams per kilogram per day, increasing to 1.2 milligrams per kilogram per day. The maximum is usually the lower of 1.4 milligrams per kilogram per day or 100 milligrams per day. For those over 70 kilograms, a common starting dose is 40 milligrams daily, increasing to 80 milligrams daily. The maximum daily dose is commonly 100 milligrams per day. Atomoxetine dosing is not a guessing game. Weight, side effects, and metabolism all matter. How patients usually take atomoxetine It's usually taken once daily in the morning. If nausea occurs, taking it with food may help. Do not open capsules. The powder can irritate the eyes, swallowed whole only. Take atomoxetine every day as prescribed. It is not a quick focus pill. It builds over time. Common side effects include nausea, stomach upset, and decreased appetite. Dry mouth, sleepiness, fatigue, dizziness, headache, and insomnia are also common. Watch for irritability, increased heart rate, blood pressure, and sweating. Important safety warnings. Atomoxetine carries a warning about suicidal thoughts in children. Families should monitor for new suicidal thoughts, worsening mood, agitation, or irritability. If someone is in danger, call or text 988 for the Suicide and Crisis Lifeline. Liver injury. Atomoxetine has rarely been associated with severe liver injury. Report yellowing of the skin or eyes, dark urine, or upper right abdominal pain immediately. Heart rate and blood pressure. Consider cardiac history and monitor regularly. Mood activation. Screen for bipolar disorder before starting to avoid mania activation. Drug interactions. Atomoxetine is metabolized by CYP2D6 enzymes. Watch for inhibitors. What families should understand. It takes time. Help monitor focus, mood, and appetite. Teaching points. Atomoxetine is a non-stimulant that takes time and uses weight-based dosing. Monitor for suicidal thoughts, liver signs, and heart rate or blood pressure changes. Thank you for watching. Again, my name is Dr. Ben Osevwe, DNP-PMHNP. For support, you can text 832-991-6516. Join our mentorship family today. Please subscribe to our YouTube channel and visit rotationmatchnetwork.com. Thank you.